Thank you, Andrew. First, I do want to congratulate all the finalists and all the winners. I mean, you guys are fantastic, and I say this with a lot of years to make that judgment, let me tell you. I also want to give a lot of thanks to Evan, David, Andy, and Eric. Your job today, I came not knowing much. You've done a great job. This is a great show today, and everybody should be very proud of this show. My job is to talk about the Judges Award for the Developing World. In emerging economies, large and rapidly growing populations have been instrumental drivers of economic growth. While some countries in the developing world have benefited economically from their demographics, clear barriers to including more people in the workforce exist very profoundly. Perhaps most unyielding among these challenges are the social, cultural barriers, I think most of you really understand well here, that prevent women, including women who have received an education, from receiving their full employment opportunities and full potential in their lives. Our Judges' Choice Award winner for the Developing World Focus category is directly addressing this issue in Pakistan. 65% of graduating medical students in that country are female, yet 75% of these women are still not participating in the healthcare industry. By the way, to give you some context, I actually am on the board of one of the largest global health institutions in the private sector, the Cleveland Clinic, so I have some appreciation of what this is on a national scale, and I really want to give my congratulations to what's been done here and the focus of this. Due to the social, cultural barriers that discriminate against women and discourage them from working in public spaces, over 50,000 licensed female medical professionals are excluded from the healthcare workforce. Our Judges' Choice Award in this Developing World category is leveraging a digital health platform to bring more women professionals into the Pakistani healthcare system and also to serve more females in the country, a challenge that is literally a matter of life and death. Let me cue the video.
Getting to hospital is becoming too hard and expensive for her. But now a new clinic on her doorstep in Karachi is offering Salma access to a female doctor via a video link. Out of nearly 70,000 female students who graduate from medical school, only 14% of them go on to practice. So now it's social enterprises like doctors that are filling in the gaps using technology. They've already reached over 3,000 patients, and the team aims to expand its specialist teleconsultations across the country.
Without further ado, I'm pleased to present the Judges' Choice Award in the Developing World category to doctHERs. Please join me in welcoming doctHERs co-founder, Dr. Asher Hassan, to the stage. Congratulations, outstanding. This is good.
Thanks very much.
Thank you. Dr. Hassan,
Oh, yes, you do. There you go.
I know, help.
I knew there was something missing. Okay.
With what you've been through, what is the most profound learning that you've experienced that's going to help you take this to the next stage?
So I think one of our key learnings has been that that if we persevere, we can actually transcend and overcome significant socio-cultural barriers. So my two co-founders, who couldn't be here tonight, Sarah, this award is also on their behalf, Sarah and Ifat, actually embody that experience. Both of them were female doctors. Both of them got married into middle upper income families. Their in-laws did not want them to work. There was significant social pressure put on them. There's a strange kind of counterintuitive phenomena there called the doctor bride, where a lot of these doctors become trophy wives, and their in-laws don't want them to work because they don't want to create a perception that they don't have the financial resources to take care of the daughter-in-law or the wife. And so both Sarah and Ifat went through this experience, but at some point we became aware of them, and we said, well, why don't we integrate them from home and get them to start working from home? And so we actually started prototyping and testing this model, where we started connecting these two doctors to patients who are in urban slums in remote rural areas. And we realized that this is something that actually is viable, especially if we're able to link the doctors to trusted local intermediaries such as midwives, nurses, or community health workers who intermediate. and who are who are local and at the patient side. And so both of them have obviously now gone on to, once they started working from home, their families realized that, in fact, this is something that perhaps it doesn't actually, is not causing egg on our face or anything like that, or any public embarrassment. In fact, they got very positive social feedback from the social peers who they were afraid of. So because they embody that experience, we feel that if we're able to provide a lot more, thousands more doctors who are home-based with this type of opportunity, that they too will transcend that social cultural barrier and become fully participatory in the economy.
Could you just give us one example beyond your founders of how one maybe female doctor's life has been profoundly changed because of this opportunity you've made possible?
Yeah, sure. So I'll share the example of Sonia, another doctor who works with us in our remote provider network. Again, in her instance, again, intense family pressure. She did get married into a family where it was very unusual for women to work outside the house, especially. And so she was facing, it was not just an economic issue for her, it was very much a social cultural issue. And again, in her instance, right now, she, over the last year, has now provided 1,500 consultations over the course of the last year. And she herself has generated significant income for herself, but that's not the point for her. If you ask her, how she feels, she would say, well, it's my ability to achieve my potential, and it's my ability to feel complete and fulfilled, that, there's something that I trained for, I'm now actually able to participate in. And so the sense of professional fulfillment is profound for Sonia as well as for many other women.
That's right. Congratulations again. Thank you.
Thank you.
Sincerely, congratulations.